My next guest in the waiting room, Miss Liz O'Riordan, trained and qualified as a breast cancer surgeon. She then suffered and survived from breast cancer and shares her amazing, inspiring story, which has gone on to form the seminal TED Talk, listened to and shared by many, and also the definitive textbook, The Complete Guide to Breast Cancer. Liz goes on to give many inspiring talks internationally, and her social media presence has gone on to inspire multiple men and women who have also suffered from breast cancer, but also on their own health journey. It is my great pleasure and privilege to introduce my next guest in the waiting room, Miss Dr. Surgeon Lady, Liz O'Riordan. Liz, thank you so much for being here with us.
You're welcome. I'm kind of blushing at such an introduction. You kind of forget what I've achieved in my life, but it's lovely to be here.
Well, it certainly humbles me, and listening to your story, meeting you in person, is genuinely a great privilege for me, and I'm so grateful that you're here.
You're welcome.
As with so many of the guests who have shared their story, may I ask you to tell us a little bit about where you grew up and what your childhood was like?
Yeah, I grew up in a tiny village in the Midlands. My dad was a GP, my mum was a nurse. I had a younger brother, and it was really nice. We were outside all the time, playing and cycling, and at school I was a typical girly swat. I was a straight-A student. I spent my life with my nose in a book, and it was really happy.
And where did that educational journey take you from secondary school onwards?
So I went to Cardiff University. The school told me to apply to Cambridge because I was meant to have good grades, but I didn't want to go. Initially, I wanted to go to Scotland. My mum's from Scotland and I loved it, but I couldn't put 3 Scottish universities down because no one else would consider me. So my biology teacher said, what about Cardiff? Never heard of it, went to have a look, fell in love. And I spent 14 years there doing my junior doctor, my PhD training, and loved it. And it was great to be doing what I wanted. And it was a fresh start, meeting new people and just realizing this is what I think I want to do. Although I had no idea what it was going to be like when I got through university, but I loved it.
Fantastic. And what's that feeling like of going through this horrendous bullying? And you've told us it almost went on for a year, which is traumatic enough, to finally have found a group of friends where you felt like you fit, if I may describe it that way.
I think that was the great thing about university, because you're suddenly in a class of 150 people and you mix and you mingle, you know what it's like, and there's somebody for everybody there. You find your tribe and your friends change as you go through the years. You can get very close, spending blocks of like months at a time with people, and you make some amazing friends. And it was just really nice to feel I'm normal. There are normal people like me. So we're all going to make amazing doctors at the end of the day.
Wonderful. And during medical school, were you inspired by other specialties before you found something that you wanted to fit?
It was always surgery.
Wow. And why was that?
It was always surgery. I think my dad did some gynecological surgery as well as a GP, and I had some work experience when you could go before you were 18, and I just loved being in theatre. I was fascinated by the operation and what they were doing. This was it. I was a pyjama wearer. I didn't like medicine. I got bored with people talking about trials and changing drugs, and I wanted to see what was inside them. And you go through everything, but I kept coming back to surgery. It was the fact that it's like the logic problem. You talk to someone, you examine them, you think they've got a bowel cancer, you open them up, they have, you take it out, you make them better. I just love that complete package. My first job was a mixture of paediatric surgery and professorial surgery on the breast unit, and I loved it. I got to operate. It was scary dealing with children. The first cannula I put in was a 36-week-old baby with a pyloric stenosis, and they're tiny. It's like, I can't get anything in this. And then to go from babies to adults thinking, God, these veins are huge. But I just loved it. I wanted to do more. Medicine was just a rite of passage. And I really enjoyed it, but I was still desperate to get back to surgery. And I nearly didn't make it in the next step. You have interviews to move on to SHO training. And the way medicine works is you can't go for an interview and get a job and turn it down. You have to say yes, because the hassle of arranging an interview panel, and no friends who've done it, and they'd write to their referees and say, don't give them a reference again. And Cardiff was the last job to be advertised, and I wanted to stay because all my friends had got jobs in the area as well. And so I turned down. I didn't apply for jobs all over the UK, and Cardiff was the last one. So if I didn't get it, I'd be unemployed, and I just bought a house. So the pressures are high. And the day before my interview, I was on call. I'd had a night shift from hell. I got home, I showered, I put my suit on, and I woke up on the sofa having overslept, having missed my slot.
Oh my God.
And I rang them and they said, we'll squeeze you in at the end. So I dashed up there, this hot, sweaty, dishevelled mess, and somehow got the interview. One of only 2 women out of 13.
Wow.
And spent the next 3 years learning the craft of orthopedics, trauma, general surgery, urology. And that was hard because you're revising again. People don't realise that you have to do exams to move up the medical career ladder, and you have to pay. So I think it was £1,500 at the time for the exams, plus 700 quid for each course you had to do. And you're working, and you're doing night shifts and 100-hour weeks. And suddenly those days we will spend 8 hours in the library at medical school. It's like, no, you had to find a new way to revise, which is really hard.
Yes, absolutely. And you're very humble about the achievements that you've had. And despite me saying so, you do inspire and have a huge following, and so many of them are women because they're inspired by what you've achieved. And a lot of that actually comes before breast cancer touched your life. Can you give us an insight into what it was like being a woman training for surgery? And I'd also like to hear about your joy in surgery and perhaps one of your first memories of being a surgeon and operating.
I think I'll start with that first. And for me, it was, you see someone who's come in through A&E and you have the classic signs of appendicitis, but you don't believe they're real. And then you see someone and you think they might have it, and you press the tummy, you think, oh, they might. And then the registrar comes along and says, yes, book them. And then you get to go to theatre in the middle of the night and have a look, and you put your finger in and you feel this wiggly worm that's inflamed, and they let you take it out. You go, wow, this is amazing. It works. Surgery works. And then you see them the next day and they walk out of hospital. And it was just that fascination. And you kind of go through stages of, wow, that's bowel, it's moving, to what instrument are they using to do that? And how are they tying that knot? To, can I cut that blood vessel? To then suddenly, oh, there's no one over my shoulder anymore. And I just loved that. But it has its lows because people die and you get things wrong. And it's a real emotional roller coaster. I think at the time, it's a little bit better now, it was very much a man's world. And surgeons were still seen as, gods is the wrong word, but there's a lot of power being able to go into an operating theatre and open someone up. And you're wearing pajamas, so you don't have your professional uniform on. You're standing right next to someone in a very tense environment, basically wearing a bit of cotton. So you don't have your normal barriers. And there was an awful lot of bullying and sexual harassment and sleeping around. And I think a lot of women found that very, very hard to deal with. I know I did. And it was either, I either have to be very coy and very prim and get offended by all the jokes that I actually find quite funny. And then I was seen as the token lesbian on the ward. Again, this is back in the early 90s. And then you're not let into the men's club because the men are in the operating rooms talking and changing together and you're in the nurse's room on the outside. Or you drink with the blokes and you have a pint and you tell a dirty joke and you invent a sex life to keep them occupied. And then you're not seen as a woman, you're seen as one of the lads. And you don't know what to do when you get sexually harassed. If you whistleblow, you worry, well, I need a reference to get the next job. And if I accuse my boss of touching me up, then I'm going to be unemployed. And it's a lot better now. But I think every year I moved on, it's weird, you must have found this. You suddenly go from your first year to second year, you develop the confidence to do an operation or a task that you couldn't have done yesterday. And nothing has changed. It's just your name, your job. Yep. And I think with every new job, I got another layer of confidence until you finally learn, these are my lines. I won't let you go above them. And I'm confident enough to say that's not on. But it took time.
Absolutely.
And it's in all walks of life. It's not just surgery. It's that whole male-female hierarchy when women are trying to break the glass ceiling. Absolutely.
And it shouldn't be this way. And I think we have to fairly say that sexual discrimination still goes on. We're still trying to balance hierarchies, but I feel we're still far away from that. Did imposter syndrome ever affect you?
I think it affects everybody, doesn't it? I think we all feel it, even now. There is something about standing up in front of a room full of people, going to see a small child and do a baby check, telling someone they've got cancer, you think, am I good enough? Have I done the training? Do I know what I'm doing? Am I the right person? We all feel it. And I think as you get older and you watch your bosses, you learn what they do. And it's kind of inside, you're going, oh my God, oh my God, oh my God. But you learn to have that calm on the outside so they trust you.
Yes.
Everybody has it. We all cry at night, we all make mistakes. And I think the general public don't understand what it's like to be a doctor carrying the weight of their patients with them. And the things we're meant to do, day in, day out, without a break, to move from making someone cry to telling someone off to doing this. And it's just, you're not taught how to deal with your emotions.
Absolutely.
You're meant to be this calm, controlled robot that doesn't make a mistake, and then you go home and fall in a heap. And I think we're getting a lot better at that, especially through the pandemic and the horrific burnout and the mental stress. I think we're getting better at looking after ourselves.
When did the theme of breast cancer surgery come into your journey?
So I've done breast cancer quite a lot. It was my first job as a junior doctor. I did it again as a SHO. I did it again as a registrar, but I was always a bit bored. It used to be, slash and grab is the wrong word, but it was just a simple mastectomy or remove the lump. There was no finesse about it. And throughout I was 3 years into my registrar training, so this would have been about 2007 or 8. I was getting really fed up. I was still getting a lot of criticism at work. And I think, as you know, doctors are often coached with negative criticism, humiliation. You're not praised when you do something right. You're bollocked when you do something wrong. And I'd had enough. And I was lonely. I was single. I had 2 cats. I couldn't see my friends. I was working long hours. And I thought I'd rather work in a supermarket stacking shelves and have a social life and no one telling me I'm shit than carry on.
Yes.
And I thought, I need to get out. And then I did breast surgery again, and it had changed. In those 3 years, it was no longer take a breast away. It was plastic surgery. It was hiding scars around the nipples. It was reshaping the breast tissue. It was reconstructing a breast. I thought, wow. And then I realized there's no on-call. So I don't have to get up in the middle of the night panicking about what I'm going to do or what's going to happen. There were no real patients on the wards. And it was a lot of clinics, and I loved talking to people. And I just suddenly felt this is the career for me. Plus, my husband was my boss, and he asked me out the day I moved to go to another hospital. And I thought, if we're both doing careers with on-calls, we will never see each other. And I just fell in love with speciality. It's that the craft work and the dressmaking, because every woman is different, and just the ability to almost make magic.
Yes. Wonderful. And the reason I asked this next question is because we are about to enter the theme of breast cancer for yourself and you becoming a patient. But also it's frightening to think that someone as talented and as qualified and as educated as you at one point was going to give it all up.
Yeah.
And we've had this insight of why that was. And I think it's fair to say, because you were a woman in surgery and you'd gone so far, but you were facing challenges that I as a man will probably not face.
I think it's not just because I was a woman, it's because of me, my personality. But going back to being single, as a male doctor, you have a huge dating pool. But if you are a woman and you are a senior doctor, there isn't that dating pool available because there are very, very few single male nurses, physiotherapists, doctors. And I was very aware once I was dating a doctor younger than me, and I'm the cougar, you know, who does she think she's doing, shagging the younger guy? And then if you're the woman sleeping with a consultant, you're sleeping your way to the top. And any man you meet in a nightclub, what do you do? I'm a doctor. It's either, God, she earns too much. They're not confident enough to be with a woman who might earn more than them. And I found that loneliness, having left all my friends and moved away, and you can't do nightclub classes regularly because all the on-calls are so irregular. Plus you're writing up papers and things. And it was that life. Yes. And I almost wanted a wife. So there was someone at home to talk to when I got in at night, to make the bed and talk to when I'm brushing my teeth. I think it was that sense of loneliness. And then I went to Paris with one of my best friends and got drunk and told her I fancied my boss. But nothing's going to happen because I'm moving an hour away. It's all fine. And the day I moved, he asked me out.
May I ask, what is it that Dermot, your husband, does for you?
He gave me that. I wasn't lonely or isolated anymore. I had someone to spend my life with. Suddenly work was more bearable and I could focus on becoming a good breast surgeon because I had someone at home.
Wonderful. You achieved one of those wonderful pinnacles in surgery, and that is becoming a consultant in your field. What was that like for you?
Exhilarating and terrifying all at once, because you realise there's no one looking over your shoulder telling you what to do. Can I cut that bit of tissue away? Should you do this? No one is listening to you breaking bad news and giving you tips and advice. No one is double checking your decisions. But to have a woman come in, you don't, also I didn't realise how hard it is to break bad news when you're the consultant, because you do it as a trainee, but suddenly they're your responsibility and you feel their emotion because you are the one who's broken them and you have to make them better. But it's such a privilege to be able to do that and then to operate on them and to see them in a clinic and they can't see the scar because the stitches are hidden around the nipple and they're smiling and you give them good news. It's like this. Finally getting that feedback to follow someone through, and I've done that and I've helped them, was just made everything worth it.
Can you tell us how breast cancer came into this journey, this wonderful journey that you've had and this great pinnacle that you achieved?
So I never checked my breasts. I never thought it would happen to me. I spent my days telling women to, but I never did. I'd had 2 cysts 6 months before I was diagnosed, and I had another lump. And I wasn't worried because I knew it was a cyst. And I told my mum, and she said, will you just get it checked out? And this was back in July 2015. I was 40. And I knew it would be normal because I'd had a normal mammogram, and I went to see my surgeon and she trained me. She was a mentor and a friend. The mammogram was normal. She said, well, I don't know what this is. We'll get an ultrasound. And I lay there on the couch and I looked at the screen because I do ultrasounds, and I saw a cancer. And I think most patients who present with a worrying symptom, you may have a feeling in the back of your mind that's what it is, but you are drip-fed information. We'll get a scan, you come back for the results. We'll do a biopsy, then we'll operate. We'll give you the results, we'll tell you what that means. When I saw that cancer on the screen, I knew I need chemo, it was big, I need a mastectomy, a good idea what my 10-year survival would be. And my life changed forever. And I wasn't emotional. I think that day I saw the screen, it's like a light bulb went off to preserve myself. And I was up here floating, looking at happening to someone else. And part of me now still doesn't think I've had cancer twice.
Wow.
It was really hard being a doctor, getting your own illness, because you can't unlearn the information you have. I've seen the very best and the very worst.
But you also did these wonderful things to give you moments of joy. And can you tell us about some of the things that you did before getting the formal diagnosis, knowing you knew what it was?
So I think I was very aware my life was going to change, even though my husband didn't believe me. So we went to a beach the day before I knew I'd get the results. And we went to a beach with the dogs, walking, playing in the sea. And I just wanted some happy memories before my life officially changed forever. And then the day before I started chemotherapy, we did something similar. Posing for photos in a field when I knew I still have my hair. And it was just, I want to remember how I used to look like before my life changed forever. And I look back at them and it's really sad because I almost don't recognize that woman. I am such a completely different person, physically and mentally. But it was just taking advantage of those moments to realize how what you have is really precious and you never know what's around the corner. An MRI showed that my cancer had shrunk from 5.5 centimeters to it disappeared. But I still had a mastectomy because I'm quite small, there's not much of me. And I had an implant and reconstruction. And that was really, really hard because I had to give up control. I wanted to tell my surgeon what stitches to use and where to put the drain. And he's like, no, stop it. And I think Dermot found that really hard. They had to ban him from the theatres and find someone to go and walk away because he could have come in because he worked there. And I remember going to get the news and it was the 23rd of December. And I dressed up, I got my makeup on, I'd drawn on my eyebrows, I got a hat. It's going to be good because I knew the scans had shown that it had disappeared. And I remember sitting in that waiting room for the first time, seeing all these other couples. And they're holding on to their partner's hand and they're looking at the floor thinking, it's Christmas, I'm about to get bad news. And I thought, I'm so glad I never have to go through this again. And then my surgeon, who's a friend, said, there was 13 centimetres of cancer left in your breast and 3 of the nodes were positive. And I swore, and I thought she said 3 millimetres, not 13 centimetres. I thought, what? That was the first time I got bad news without knowing it was coming. And it's like a floor opened up. And I heard nothing of what, I just wanted to run out of that room screaming. And instead, she had to go through further treatment to remove more lymph nodes. And did I want radiotherapy? And this is like, I can't deal with it. And then having to do the walk of shame through the clinic, past all those other couples, trying to stop yourself crying in case you meet someone you know, walking out the hospital. It was just, and again, I knew what that meant for the future. I knew having a cancer that big and having positive lymph nodes meant my chance of survival was even less. Couldn't tell my husband that. And I got to ring my parents the day before Christmas and say, guess what?
And if I may go back to some moments in your journey, first of all, I think it's important to say that at this time, you have written what is seminal to me, an important blog, detailing in haunting detail, in so many oftentimes beautifully written, but also painfully written about your experiences. And I would highlight that to anyone, whether you have breast cancer or not, to appreciate the experiences you went through. What did you feel about your body during this phase, and especially before you had the treatments?
Yeah, well, I think I want to say about blogging. Lots of people are writing blogs now, and it can be a brilliant way to find out what the journey is like, because you don't want to be alone. But there are some blogs that can upset you. They're not written in a style you'd like. I tried to write it as a doctor to explain what was happening to patients, because some can be naturally quite shocking to read because you have these really strong emotions. And I just wanted to write something that was real and honest, and there are so many out there. I was lucky because I had 5 months to decide whether I wanted a reconstruction during chemo, but many women only get 1 or 2 weeks. And when you're having chemo first, there's still a lump you can feel. You think, do you touch your breast? Do you let your partner touch the breast because it's cancer? And then you lose the hair on your head and you don't recognize yourself. And for me, it was really hard losing my eyelashes because I just felt like an alien. There are no feminine features at all. And it was, my body hadn't betrayed me, but I didn't feel female. I didn't feel sexy. I felt like this. I wouldn't look at myself in the mirror. And even now I find it very hard to look at the scars. I'd only look from the head down.
You decided to announce to your social media following. And can you share us the insights of why you wanted to do that and why that was important?
So I got the results on the Friday. On the Saturday morning, I posted a tweet saying, I'm coming out. I've got breast cancer. And that changed my life for the better in so many ways. I was flooded with messages of sympathy and support from people telling me what to do. Kate Granger, the late Kate Granger, behind the Hello, My Name Is campaign, and Professor Trish Greenhouse both privately messaged me, and we were having chemo at the same day. And suddenly I could talk to doctors who were having chemo and talk about how hard it is being on the other side of the table. And it was a lifeline. And now it's become a place for me to work. I can carry on helping people by sharing tips, by talking about things. But it's hard putting your head above the parapet and burying your life. Not everyone agrees with you. You do get unpleasant comments, and it's very easy to respond and rise to the bait and think, no, I'm digging a hole here. And there are dangers with it, but on the whole, it's been a lovely way just to help people and actually help doctors and medical students and nurses realise how they can improve care for patients as well.
Can you tell us about the jar of joy?
I can. So we talked about how my cancer had grown into my lymph nodes during chemo, and I got through Christmas. It was really, really hard, and it was New Year's Eve, and I just couldn't see the point in celebrating. It's grown, it's come back, I'll be dead in a couple of years, what's the point? And then I thought my mum said, you've got to pull yourself out of this. And I'll give you a week of wallowing and then it's time to move on because you're going to drive me mad. And I just thought, I need to do something to make me realise that life is worth living. And I tried gratitude journals in the past to write down 3 things every day. And it's too much like hard work. And then I thought, I'm just going to get an old goldfish bowl. And every time something good happens, I'm going to put it on a piece of paper and put it in the bowl so I can see it. And it doesn't have to be every day. Weeks may go by, but I'm hoping that seeing the cards fill would make me smile. And it worked. And I got the jar, a vase, and my husband put the first one in, toe rag. He found a fiver in the back in a pair of trousers he hadn't worn for a couple of years. And then we used to keep our dogs in the kitchen, but he let the puppy come through and sit on the sofa, and that was my first one. And it worked, just building those cards. And then at the end of every year, we'd take them out and read them and remember everything we'd done. And I think it made us do more stuff together.
One other thing I want to ask is that for so long, you didn't really accept that you had breast cancer.
No.
And have you accepted that? Did that come at any point?
Part of me still doesn't think I've had it. I can't believe I've gone through all of this because I think I've looked after metastatic cancer patients who have died. I've lost friends. I've had friends who've lost friends. And there's a part of me that cannot bear to think that could happen to me because, and I only see the worst cases as a doctor. I don't see the good cases. I'm trying to protect myself from that. And it's self-preservation.
You were invited, as a very few privileged number of people are, to give and share your experiences in a TED Talk. What was that experience?
TEDx, it wasn't quite that big.
Oh, apologies, TEDx.
Don't dig me up. So there's an amazing paediatric surgeon called Ross Fisher who told me how to do a presentation properly before I was diagnosed. He and I both believe that there shouldn't be words on slides. And Ross coached me. And I think the thing about TED, normally when you give a talk as a doctor, you have your research, you're going to present it, this is what I'm going to tell you. TED are like, well, so what? Why do the audience care? And the audience buy tickets before they know who's speaking. And it was, you want me to talk about breast cancer, but why do a room full of German 30 and 40-year-olds care that I've had breast cancer? What spin can I put on it? And it transformed how I talk. And it was giving the audience something from that. So they go away with a call to action, they go with something. But I have never rehearsed so hard for anything in my life. Because you're on the red circle, you can't move, the lights are at you, you can't see the people. There's a timer, you've got the 15 minutes, you want it to be really slick. And I was terrified. That adrenaline, you know, you need to have a wee. It's like, oh my God. But going on and doing it was such a buzz.
Yes. And
then I had to wait for 6 other people to give their talks before half time to find out from anyone, was that okay? Did I do all right? But I love, there's something, I think a lot of medicine is acting. We play different roles. You're telling someone off, you're breaking bad news, you're being the boss in the theatre. It's role play, it's how you cope. And there is something magical for me about getting on a stage and telling a story and making people cry and making them laugh and making them feel and move and remember what you've said and hopefully change someone's life for the better.
Can you leave us with some of the pearls of things that you've gathered along this journey that you've been on, that you still continue to be on?
Wow. Big question. Let me have a I think life is short and you never know what's around the corner. And it's the memories that you make with the people you love that are the things you will remember and they will remember when you're gone. I think I'm a big believer in karma. I think I'm not spiritual, but I think things happen for a reason. And I'm almost, glad is the wrong word, but I got a wake-up call at 40. The life was not all about work. And I think I am a stronger, more confident, happier woman, having been through everything I've been through. It's given me a new purpose. And it's made me realise that you can change your career. You can change your path. And it's terrifying. But just because you started out as one thing doesn't mean you have to be another.
Wonderful. Listening to us now, there will be NHS workers, doctors, surgeons, medical students, nursing students, nurses, receptionists, porters, anyone who works in a healthcare setting, many of whom will feel burned out, disillusioned, undervalued.
Yeah.
What is your message to them, having been a valued, successful, skilled worker within the NHS and also being a benefactor of the NHS?
I know how you feel because I've been where you are. And I feel so lucky that I retired before the pandemic hit and I haven't had to go through this. And I cannot imagine how hard it has been. Plus the daily, almost daily berating in the media and all those people protesting when you're just trying to help. I think it's important to recognise that burnout is serious and you need to know what your warning signs are. Family and friends, colleagues, co-workers might not care, but you need to know. And it is okay to sign yourself off sick. Now, it's really hard to do when you know you are leaving a service who is struggling, but you do need to try and find time to look after yourself. And it's easy to say than done, and I don't know how you guys do it. For me, I used to have double maths. On a Friday, I would have 2 clinics, I would just break women. Cancer, chemo, it's come back. And the thing that helped me was having a playlist of happy songs. We've all got a song that just makes your shoulder jiggle, or you kind of, whatever it is, it makes you smile. And I'd have a playlist and I'd listen to it. And if I still wasn't smiling when I got home, I'd sit in the car in the drive and listen to it until I thought, right, okay. Because I have to go back and be a wife or a mother or a father or a friend. I can't let work get into me. And just that moment to try and reset can help. But there is help available.
Wonderful.
Occupational health, GPs, counsellors, you're not alone. It is an illness and we need to help you.
Brilliant.
And thank you for everything you've done.
Thank you. And that was going to be my last question of everyone who has played a part in your journey, be it professional or personal, what is your message for them?
I wouldn't be here without a huge network of people who have helped me, give me the strength to carry on doing what I'm doing, and you all know who you are.
Thank you.
You're welcome.
No, thank you. I'm so, so grateful, Liz, for everything that you've done and for your precious time and for the insights that you've given to us. So thank you so much.